My name is Brandon Broome. I'm an orthopedic surgeon with the Paso Orthopaedic Surgery Group, and I specialize in hip and knee replacement surgery. I was born and raised in Lubbock, Texas, so I'm a West Texan by heart, and my wife's actually not far from there. She grew up in Clovis, New Mexico, did my medical training at Texas Tech in Lubbock, and then we moved away together to Louisville, Kentucky for orthopedic residency training, and we loved it there. Was seeking out a good fellowship program for hip and knee replacement, and ended up in Greenville, South Carolina with the Stedman Hawkins Clinic of the Carolinas, a very well-known orthopedic group. And we loved South Carolina. We fell in love with it so much we stayed there and started my practice there for a couple of years, and was very busy, but it wasn't home. And so we've been seeking home and missed the family, and so I'm very eager to get back to Texas, and we're not in our hometown, but we're much closer to it now, and it's going to be a great opportunity. Growing up, it was really funny. My family was always around the hospital. My dad worked in the hospital, my mom worked there, my uncle was an OB/GYN, and so I was always exposed to it. But probably the biggest thing was that I was a very accident-prone kid. I was always breaking something or injuring something in sports, and I think that early exposure just kind of gave me a little bit of interest in it. I knew pretty much from an early age that that's what I wanted to do. And tried some other things. I tried going the business route in college, and just didn't do it for me. And I knew pretty right away after college that I needed to go back and do medical school. It just, for me, it's the most fulfilling thing. In my training, I was very fortunate to be one of the first guys in Louisville, Kentucky that was doing the anterior approach to hip replacement. Happened to get there along the time I started residency, which was very nice for me. This is a newer approach to hip replacement that a lot of other people just aren't familiar with. The benefits of that over the other approaches where you make an incision in the back or the side of the hip is that we don't cut any muscles, and so the pain and the discomfort from the surgery is much less, and the recovery time is overnight different. Most of my folks only stay in the hospital overnight, and I think ultimately there are a lot of people that do hip and knee replacements, and for me per se, that may be the one thing that I do differently in the area right now. Probably the most rewarding thing from the patient standpoint that I see and that we've seen throughout time is taking an arthritic joint like a hip or a knee when people are so severely debilitated, they can't even get their shoes and socks on. Going to church, getting the mail is no fun because they hurt so bad. To take that and basically instantly change that and give them the function back and take the pain away, to me that's been the most rewarding thing. And it amazes me on a daily basis with the work that we do in surgery that these people actually that quickly after surgery, the next day can look at you and say, "Thank you, my pain's gone." It blows my mind even after doing it hundreds and hundreds of times. I am married and I have 2 children, and this is really the pride and joy of my life before work. And so my wife was a former architect, and now she's a domestic engineer, and she's way busier than I am. Our 2 children are a handful, and we pretty much spend all our spare time with them right now. And outside of that, I like to hike and camp and mountain bike, and very big into fly fishing, and can't wait till my son's old enough to enjoy that with me. Patients' biggest apprehension before surgery is pain, and they don't really know what to expect. And so we try to have a very good program for you to know what you're getting into ahead of time to try to ease that anxiety. We have a class a few weeks before your surgery, and we try to really prepare you on everything, what to expect. We have much better anesthesia protocols now in general, so the whole process now is very much less painful than it used to be several years ago. I think the biggest thing is having a personal connection with your doctor, whoever it is, and all of us have different things that we do, different procedures, different ways of getting you to that point where you want to be. But at the end of the day, the most important thing is making that personal connection. And you can't ever be 100% satisfied with everyone in life, but I try my best to do that and really work a plan up for you personally, and something that we both agree on 100% before we proceed with, for sure with surgery, but really with any treatment plan.